Hey guys, I'm back. Scrap and Abby here again. So this is going to be a part 2 of a video I'm doing, which is a combination of my surgery, how it went, and my recovery, and my additional diagnosis of another facial nerve pain since my trigeminal neuralgia MVD slash neurolysis surgery that I had on March 2nd. So this is part 2 because the first part was probably a little too long, and the fact that my husband came home and I had to take care of some stuff. So this is part 2 of that video of my post-op journey with trigeminal neuralgia. So I try to remember where I left off. I think I was talking about the anesthesia dolorosa, and again, I'll put a link in the description below as to what that is. So if you guys are watching this, make sure you watch part 1, or else it's not going to make any sense what I'm talking about. Anyway, so the pain, what I'm feeling with this second facial nerve pain I was diagnosed with, and it's doing it right now, and it's just the most bizarre sensation. It's like it goes like right here, not on my nose really, but more underneath the nose kind of, and it goes right along here, and it's like right here, and it feels like it's this tickly nerves kind of, that tingle in your spine, like when you watch something scary or whatever. That's that sensation I'm getting, and it feels like my skin should be bubbling or something. I can't explain it very well, but just by me describing that to my neurosurgeon, he knew right away that that's what it was, because it's a different type of pain, kind of a burning in my cheek, which is really, really uncomfortable. It's not the stabbing pain I had, of course, before with the TN, but this is very annoying on its own accord. And so I have that, and then battling the numbness, like I was telling you guys, like my lips tingle on the left side only, kind of a burning sensation. And I'm not really painting a very pretty picture for anybody who has to have, the surgery for trigeminal neuralgia. But again, what I was diagnosed with was just the anesthesia dolorosa. That is a very rare nerve disorder. It is not something that everybody's going to get. So I don't want you guys to freak out thinking, oh my gosh, I have this surgery and then I'm going to get something else on top of it. I mean, they didn't even talk about this with me, and they were very good at researching, or not researching, I'm sorry. They're very thorough in telling me what to expect from surgery and complications and all that. So this is just, something, unfortunately, that I have now, and I'm doing my best to live and deal with that. It's not easy. I have my good days and I have my not so good days, and I have some better days. Trying to adjust, but it's definitely different because to everybody, just like when you have trigeminal neuralgia, everybody says, oh, well, you don't look like you hurt. Oh, you don't, I don't see anything wrong. You look fine. And, because there's no physical, it's not like your face is, broke out in some kind of a rash. Sometimes I've seen people on the Facebook groups that happen, but that never happened to me. I don't know if it's because my skin is darker or what, but it's never happened to me. And it's not like you have a wound or a missing limb or, something people are familiar with, like, different types of cancers and such. So it's kind of discouraging because you have so much pain, and then you deal with that pain, and then it's emotionally wearing on you, it's physically wearing on you because you're so tired from the pain. I have a job where I work in the public. I work for the school district where I live, in the district administration office in a tech department, and so obviously I'm dealing with hundreds of staff and students, and emails and phone calls and people walking in, and you kind of have to have that, hey, hi, how's it going, kind of look. And it's so hard when you feel so bad and all you want to do is go home and curl up in a ball. So I was off work for an additional 2 weeks. I don't think I mentioned that in the first video. I was going to go back at 6 weeks, but they saw me at I think it was about 6 weeks post-op, somewhere around there. And they said that, or they didn't actually see me. They talked to me on the phone, and they said, we're going to keep you off an additional 2 weeks because I was having that new pain happening and a little bit of the clear discharge from my nose. And so they wanted to kind of still keep me, not moving around too much, and, and all that, and just kind of resting some more. So I went back to work on April 27th. I think that was a Monday. And then I was seen back up in Portland at OHSU, where I had my surgery, just repeating that for anybody who's forgotten where I had surgery, or I didn't say at the beginning of this second part. And they saw me on May 7th, and that's when they said, you have the anesthesia dolorosa. So anyway, I'm on the gabapentin again, and I'm hoping that it's going to work for me. It's frustrating because, of course, I went into surgery thinking, I wouldn't have to have any complications other than my face just being numb, because I knew from before I had surgery they were going to at least do that at the minimum. So I was prepared for that, but I wasn't prepared obviously to be told I have a second facial pain, and it can't be treated with surgery or any type of, any of the other types of procedures people do, gamma knife. It doesn't, none of it, there's nothing to fix it. It's, you just either take the anti-seizure medications or you just kind of deal. And I'm willing to go back on the medication. Obviously I am. I'm like 2 weeks in, I think, almost. And I'm going to give it a try. I can't take the Tegretol, which is like the best one to take, because I took that before, and I think I documented that in my earlier videos before surgery. I broke out in a really bad rash. My skin turned red, and it's not like I'm, pitch black or anything. I'm African American, in case you guys are wondering. But anyway, so it's not like my skin is super, super dark, but I have to, it has to be pretty significant sunburn or something for my skin to really be red, like where you look at me and you're like, oh my gosh, your skin is like super red. So I broke out in a really bad rash, hit me on this side down my arm, and it was red and itchy and it was burning, and so I had to stop taking it immediately. So they're obviously Tegretol is not an option for me ever, and so they're hoping that the gabapentin is going to work and give me some relief. So I have to do report though that last Thursday was probably the best day that I've had since this whole nightmare started, which was last August 26th. I'll never forget the date that I woke up with this pain. It was actually been in remission for 4 years. I had a bout of the pain in November of 2010, and then it lasted about a month, and then it just went away. And my doctor was like, it's just my family doctor was just like, maybe just some kind of a weird nerve thing, whatever, and it went away, never came back. And then Tuesday, August 26th, I woke up, bam, instant pain back, and it never relented. So it was, last Thursday was probably the best day that I've had, and it was a really good day. I was having the pain, still having that weird sensation, the burning in my cheek, the numbness is still there, that'll be there for life, kind of thing. And I have some pretty intense headaches off and on still from the clamp I had on my head during surgery. But emotionally, I felt really, really good, because I've been kind of in a dark place, depression, and because you just feel like, when is this going to stop? Because I go through such an extreme surgery to get rid of the pain, and then as a direct result of having that surgery, I acquire a new nerve facial pain. So you're just kind of like, what is going on? And it's hard. And I'm usually a really pretty happy, joking around. I love to joke around and, prank and that kind of stuff. That's just my nature. I'm generally a happy person. And this has really changed me kind of a little bit. And I kind of want that old Abby, the old scrapping Abby back. So I've really been trying to do a lot of things since I started feeling a little bit better last Thursday, and maybe it's the medication working. I have a lot of family and friends praying for me, and I believe in God, and I'm a Christian, and I believe in the power of prayer, and so I absolutely know that is a big piece of it as well. But I'm also wondering if maybe the gabapentin is kind of working, and so I've been working on getting my craft room put back together. As I mentioned in the first video, we moved when I was about a month out from surgery. Probably the best move, easiest for me, because all I had to do was say, yeah, that goes here, that goes there. I had, we had a lot of friends come over, and my really good friend Alicia, she's watching. Hi, Alicia. She and I have been friends for like over 20 years. And anyway, she come over, and she was basically me, meaning she was moving all the things that I would have moved, like my personal belongings, clothes, things like that, and helped get, the things put back in the cabinets and the fridge and that kind of stuff. So it was huge. I packed my entire craft room before I had surgery. It was hard because I was hurting so bad, but I knew I had to be the one to pack it because I have so much stuff, and I need to pack it in a way that it would make sense. So when I brought my room back together, it would make sense. And so for those of you who are not paper crafters, or you're just watching this because this is about trigeminal neuralgia, I have to just explain it is a huge, huge part of my life. And if you're a crafter and you're watching it because you're a follower of my channel, and I appreciate that, you get it, because it is just such a it's just a real big passion. It's like for a musician or something like that. You know, it's more than me just making scrapbooks and things for memories of my kids and my life and my family. You know, I'm like a semi-professional, I would say, because I'm on some design teams for some big companies in the industry. I do have a client base, you know, people who commission me to make, you know, a variety of different paper crafts. I've been doing this for 20 years this September. I started right after I had my son, doing it, and it's just really expanded. So it's been really important for me, in like a mental and emotional state, to kind of get my craft room put back together. And I haven't been in here actually making anything yet because I'm still kind of getting things put back together from the storage unit, but I would say I'm about 95% there as far as getting everything back and unboxed, and just kind of tweaking where I want things to go. So I'm trying to ride that high that I'm on right now, that I've kind of been on since last Thursday, as far as feeling good, where I don't feel like I need to rush right to bed when I get off of work and go lay down, which is what my life has been literally since August. It's just been horrendous, how it's affected my life. And I did document that in my earlier videos, so you guys can watch those if you haven't seen that yet. I kind of go over that. And it's also on my blog, which is scrappin-abby.blogspot.com. And I'll put a link to my blog too, because I did a pretty lengthy post right before I went into surgery, about what was going on and all that. So that's why I mentioned crafting. I'm not trying to get off track, but that is something that's helping me. So maybe for anybody who's going through this too, and whether you have the anesthesia dolorosa or you have just trigeminal neuralgia, and I shouldn't say it is just, because it's a horrible disease, but anybody who's going through this, like I have been and I will for the rest of my life, if maybe you can find something that gives you comfort and peace, whether it be another type of crafting, you know, like knitting, sewing, crocheting, painting, playing a musical instrument. I mean, I couldn't imagine me, you know, like playing a flute or saxophone. I mean, it's hard enough for me to even, you know, drink out of a straw sometimes, because I'm still adjusting to that, you know. So it's uncomfortable for me because my face is half numb, and it's, even though I have a numb face, I have pain still from the second diagnosis. So it'd be difficult for me to imagine doing that. But, you know, whatever the avenue is, maybe just reading, I don't know, whatever it is, I would just try to encourage everybody, because for me personally, it has been a huge kind of lift for me, so to speak, to kind of be back into my element of the crafting and having my things around me, which might sound crazy to people who don't do this crafting like I do. So, but that's kind of where I'm at right now. So I don't have any future appointments with OHSU specifically, because, you know, as far as surgery goes, it's just, you know, the 6 months to a year, you know, the incision is sealed, looks great. I did forget to mention in the first video too, that they closed my skull. I have an opening about that big. You can see it there, about that big in my skull, the back here. They use medical cement to close it. Some physicians I know, or neurosurgeons I should say, use like titanium plate and screws, but for my doctor, they use just medical cement. And, you know, I feel like a little bit of a divot where it's at, but it's, you know, I don't like know it's anything weird. I don't feel weird or anything because I have something, you know, foreign closing my skull other than just my actual skull itself. So, you know, I'm feeling okay as far as that goes, just kind of dealing with the facial numbness. And I do have to say that my facial numbness now is less significant than it was the first half of my post-op period. So like the first 6-7 weeks, you know, it's really started to kind of not decrease significantly, like where I don't notice it anymore, but it's just not as severe, because it does actually get less in time. So I'm hopeful that that will continue on that path of being less numb in my face. When I did go on June 7th, they did take like a little safety pin and they had me close my eyes, and they were still doing some additional checking for facial numbness, which is something they did in the hospital too. I forgot to mention that. You know, so they take a safety pin and they first, you know, kind of poke around and they ask you, do you feel that? And of course I can, because my right side's totally fine. And they kind of poke around over here, and I did have a little bit less sensation kind of in this area and kind of down in here, but that's normal because of them destroying that nerve. So that's kind of expected for that to happen. You know, so they were just checking that a little bit. But other than that, I don't have to go back to Portland for anything. I just am waiting for my referral through my insurance to go through for me to be seen at the pain clinic. So I'm looking forward to that, which sounds crazy because I've been going to doctors for like a ridiculous amount of time, but I'm so anxious to get kind of a pain management plan set for me because I'm really sick and tired of this facial pain and neuralgia ruling and dictating my life, and that's what it's done, and I want my life back. And I'm halfway there because the TN pain is gone. I'm just now learning to have to cope with the new facial pain that I have. So I'm just kind of working on that. I do get a little bit of facial swelling, and when that happens, it looks like I've been in a fight, or like my eye was almost kind of closed a little bit. They have me just kind of lay down and take it easy. So there's been a couple times I've had to either go home early from work or not work at all. And I'm lucky enough to have a job where it's real flexible like that for me. And my restrictions are, they don't want me pushing and pulling, bending over, like, not that I'm like going to be doing like somersaults or anything like that, but just not like flip my head down to go pick up something and come back up real fast because I still have some head pain in general from surgery itself, and I think I'm at weight restriction of 20 pounds now, or I can lift. So it's so strange because I'm talking to you guys in this video and in the first one, and it's such a weird phenomenon because it feels like my face should just be, like I told you guys, like moving around and like jutting out my skin and stuff or whatever, because I just am having these sensations and it's just really uncomfortable, and it's really painful for me to be doing these videos right now, but I wanted to get it out there before too much more time passed because I had fully intended on making videos 1 week out, 2 weeks post-op, 3 weeks, a month out, that kind of thing. But it just didn't work out for me because of me having some pain management control issues with the pain, trying to get the right combination of pain medication, which, may or may not happen to everybody else. But for me, I had a little bit of a struggle when I came home because you get so much more relief when you're on IV medication than you do pills, at least for me. And then I obviously developed the anesthesia dolorosa, and so that was, quite a ordeal to get adjusted to having to be told you have another facial nerve pain. And then in the mix, we had the move as well. So it's been pretty busy with that. And my son moving out, like I said, he's going to college. So it's just a lot of things going on. And just trying to get my life back. So it's really kind of all I have to say right now at this point. I will do another video probably like in another month or something, or I might do a video right after my initial pain clinic appointment, whenever that may be. I don't know if there's a wait to get in. Hopefully it's not more than a week or two, just because I'm really anxious to kind of get going on a management plan for myself and kind of update you guys more. So I do apologize if this video and my first video from my post-op brain surgery, if it's real scattery, choppy, I'm really sorry. Like I said, I'm back on the gabapentin, which sometimes kind of messes with you a little bit because you're trying to get used to taking that medication, and then just the fact that I'm working with a half numb face here, people. So bear with me. I really am trying my best. So I'm gonna be working on getting some crafty videos up for anybody who's watching that is a fellow paper crafter, and getting back into doing more videos again, and just kind of pushing myself a little bit, not too much, because I do pay the price the next day if I do. I feel really bad if I push myself too much, but I'm really trying to, when I get home from work, not just run straight to bed laying down, which is where I'm going as soon as I'm done with this video because I'm really tired. But anyway, I'm just trying to do more and more, trying to get my energy up and trying to get myself used to it, because I'm just refusing to let this steal any more of my life than it already has. And I just want to enjoy every moment and, just live. So if you guys have any questions for me, please feel free to leave a comment. You can also email me. It's my email address is scrappinabby@gmail.com, and I'll put that in the description below too. And I'll try to put it at the end of the video, if not at the first part of the video, because I'm not going to watch this one all the way through, or my first part of the video, like I do my crafting videos, because I'm not going to edit anything, because I'm just talking straight to you guys. So if it's choppy and weird, that's just the way it's going to be, because I'm just trying to be as real as I can. So and also I've had a couple people reach out to me, and I haven't contacted them back who watched my videos before I had surgery, and I want to apologize to all of those people who've contacted me that I haven't written back to yet. I'm super, super sorry, but I'm hoping you guys understand based off my videos that I'm giving right now as to what's been going on. So I'm going to start getting back to, I just repeated myself. I'm sorry. I'm working on getting back into the routine of commenting back and replying and answering people. So I want to thank all my new followers and people who reached out to me who also have trigeminal neuralgia. It's been great hearing the stories of people who are in the early stages, just diagnosed, those who've had it for 20 years, those who've had surgery or different types of the different radio surgeries that I didn't have any. No matter where you are at in your journey with trigeminal neuralgia, I would love to hear from you guys, because we're kind of like our own community, and I think we're all in this together, and any support we can give each other is huge. I still watch videos from people, even ones I've already seen before. I still am an active member in the sorry, my face is freezing up. In the Facebook support groups, there's several different ones. If anybody has a Facebook, in the search, just type facial pain, trigeminal neuralgia. Off the top of my head, I can't think of all the different ones. It is a great place to go for support. I haven't been active as far as commenting so much, but like still going and checking the groups and seeing what people have said. And I've commented on people who are either going into surgery or people who've asked who has had this surgery, what are your thoughts? And I've kind of contributed in that form, because before March 2nd, I was on the flip side asking, what's it like? What can I expect? Did this medication work for you guys? So I'm hoping that I can be of some level of support and help to other people, as I've had shown to me before I had surgery. So anyways, I'm just kind of rambling now, so I'm just going to stop. So again, I'll put my email either at the beginning or the end of the video. Please contact me. I would love to hear from anybody, even if you want to share a link to your video. I would love to see that, or a link to your blog post, or whatever, whatever capacity I can be a support to somebody else, I would like to do that. So thanks, you guys, and I again will try to do another follow-up video shortly. Well, I won't have anything new to report until I go to the pain clinic, to be honest with you. But I do plan on doing, another video aside from that, just to kind of update you guys when I get to be like, 6 months post-op, and kind of how I'm comparing then to, how I am right now. So anyway, but for all my crafty peeps, I will be working on some videos. I've kind of jumped into the whole planner world. Oh my gosh, it's just another big, massive addiction, just like paper crafting. So I've kind of jumped into that world too, which is good because I need it. And I'm going to be doing some planner only videos. So I'll explain to you guys why I'm justifying in my head why it's okay for me to jump on that, realm too, because, it's an another addicting type of crafting and that kind of thing. So I'll see you guys later. Again, leave any questions, comments below. And I kind of don't want to apologize if it's kind of weird because this is kind of just how I am right now, but I do apologize if it annoys anybody that I'm rambling and going from here to there, and it's weird, but I try to be professional about it. I'm human, so what can I say? So thanks, you guys, for watching, and I will see you next time.